I'm going to demonstrate how to hang an IV piggyback medication through a running IV line. First of all, I need to check my physician's order, and my order is for Invans 400 milligrams IV piggyback now. So I will gather my equipment. I find my piggyback bag labeled in the medication room, and I attach tubing. I see a label, and I need to check it to see that it has not expired, and it has not. I also want to look at my medication bag to make sure that that has not expired, and it hasn't, so that's good. I need to make sure I have a hanger for my piggyback bag, and often this is hanging from the IV pole, but I will take one in with me. I need a sterile cap, some alcohol, and my order. Hello, my name is Sue, and I'm your nurse today. Can you tell me your name and your birthday? John Brown, December 2nd, 1960. Thank you, Mr. Brown. And do you have any allergies? No? Okay, let me see your site. Is it tender? No? Any pain? Doesn't look red, it doesn't look swollen, and the dressing is dry and intact. So now I'll look at the tubing. Before I check the tubing, I need to check my 5 rights at the bedside. So I have the right patient, John Brown. The right medication is Invans. The right dose, 400 milligrams. The right route, IV piggyback, and the right time is now. I need to check my bag and make sure that it has not expired, and it hasn't. And my tubing, which has not expired, and it's running at the rate that was ordered. So I'll hang my piggyback, and I need to infuse it into the upper Y site. So I'm going to scrub my hub for 15 seconds, and I really want to use some good friction on the hub to prevent infection. All right, and then to back prime it, I'll lower it below the primary bag and open the roller clamp. Why is it not back priming? There we go. I think it was kinked a little. So it back primes through the tubing. I turn off the roller clamp and hang it up again. Now I need to lower my primary bag on my hook, my hanger. I will open up the roller clamp on the piggyback bag, and then to set the rate, I'm going to use the roller clamp on the primary line while counting the drips in the secondary chamber, drip chamber. And I will set it for the number of drips that I had calculated. How are you feeling? Good? If I've set it correctly, it should run in 30 minutes, and at that point it will have stopped dripping. I'll turn it off, rehang my primary bag, and you can either leave the secondary tubing attached. Sometimes it gets tangled if you have a patient getting different piggybacks. So we're going to put a new sterile cap on the end to keep it sterile for the next time, since the tubing is still good. And I need to re-regulate my primary line, make sure that it's running at the rate that was originally ordered. to document. It's a medication. I would document the drug, the route that it was IV Piggyback, the dose, and what the site looked like, what the IV site looked like, that it was without pain, denied pain, no redness, swelling, and the dressing is dry and intact.